Hello and welcome again to another edition of Senior Soundings. I'm your host, Gerry LePage, and we're delighted to have you along for this episode. And to help me along to talk to everyone in the audience about something fairly new to our community is my colleague Kristin Matteson of pdbuzzNPT. That's we'll have it up on the screen here, but it's a community service originating out of Newport to support people who are dealing with Parkinson's disease. So without further ado, Kristin, welcome.
Thank you.
Thanks for joining Senior Soundings, and it's great to have you with us. So maybe we can start a little bit by just going over some of your own particular background. And have you always been in health and human services, or go ahead?
For most of my whole adult life, I'm an occupational therapist, and I've been working in Newport for 37 years as an OT in healthcare. So that is where I have my healthcare background. Mm-hmm. I've always had a passion for physical activity and getting people healthier through physical activity, and as an OT, that just kind of goes hand in hand. Right. And I became a personal trainer, a certified medical exercise specialist who can work with people with disabilities or diseases that makes it a little bit more difficult for them to participate in exercise activities.
Right, I see. So were you like a self-employed kind of freelance therapist?
No, I work at Newport Hospital.
I see,
yeah.
I see. So, okay, you were connected with them.
Yeah.
So, all right. What is pdbuzzNPT?
So in my career as a personal trainer and a cycling coach for people with Parkinson's, I was kind of led into that area specifically because of all the research around exercise and how it helps people with Parkinson's disease. And so it's one of the ways that people can reduce or slow down the progression of the disease. Outside of the medications that control the symptoms. Mm-hmm. So I became a support group leader through the American Parkinson's Disease Association, the Rhode Island chapter. They helped me establish a support group in Newport after COVID-19 pandemic, when everybody started coming out of the woodwork.
Right.
And because I realized that my clients who had Parkinson's disease didn't really have a connection to each other. Mm-hmm. Or a connection to the community of people with Parkinson's disease. So we started a support group, and through those meetings realized that there really weren't any resources for people with Parkinson's disease in Newport County. As far as exercise groups, it was the only one support group. They didn't know really where to go. So I went to a summit in Washington, D.C. by PMD Alliance, one of the national organizations that help support people with Parkinson's, and they connected me with somebody in California who had PD Buzz. At the time, it was her own website. She has Parkinson's. She wanted to help people connect, so she developed her own website and called it PD Buzz, and I thought it was a great idea, that word, and it would be great to have one in multiple places, kind of like a brand, for people to locate in different communities. So that's where I started with the PD Buzz idea. But the actual PD Buzz Newport is a community action committee, and we're a member of the Davis Phinney Foundation, which is also another Parkinson's organization, a national organization that helps people live well with the disease. They've established the Healthy Parkinson's Communities Initiative, which is to help communities become more inclusive for people with Parkinson's and to offer them, if not services specific for people with Parkinson's, then at least to have an awareness of what Parkinson's is and how it affects people's functioning. So that's what we're a member of, that organization's initiative. So we're helping to connect people in Newport County.
I see. Now, you mentioned the Davis Phinney Foundation and the American Parkinson's Disease Association. Mm-hmm. Do you sense that there is some motivation on those organizations' part to expand the PD Buzz concept to other communities throughout Rhode Island or elsewhere in the country?
There is. I think that they want to reach as many people as possible who have Parkinson's. So the Davis Phinney Foundation is trying to reach out to community leaders and establish committees, not necessarily with that logo, but because we're kind of in the middle of that community. We know, as a support group leader, I know hear the needs from the people who attend my groups and understand what they are looking for or what is lacking in the community. Mm-hmm. So they feel like having people in the community running these committees as opposed to them running it from Colorado.
Right.
So PMD Alliance definitely supports a lot of local support groups. APDA, the American Parkinson's Disease Association, has a Rhode Island chapter. So they're very helpful for people who are living in Rhode Island. They have a lot of resources. They have a information and resource referral phone number to call to find out about things that are in Rhode Island that are resources. But I think that it's real important to have somebody in the community where the people are living also to have a good insight on how to connect to them.
Understood. And I'm sure you share the same experience of the sense that support groups for not only people who have some kind of physical or health-related issue that they're dealing with, as well as their caregivers,
absolutely,
I think, derive a tremendous amount of benefit from support groups, comparing notes. How did you deal with this particular challenge or
That's
whatever,
what support groups are all about, because I can bring them together, but they really learn more from each other. In my support group that I run, a lot of the people who have Parkinson's bring their care partners with them, and so that they get to interact and hear what other care partners are going through. Sometimes we'll have a little breakout session and separate the group just so that they can have a little bit more one-on-one time with each other and different needs. We also do a lot of education. I'm an ambassador for the Parkinson's Foundation, so I can present programs that are I did some at the senior centers and locally about what is Parkinson's disease, because we really need, in order to increase our resources, we need to increase people's knowledge of what it is and the incidence and how much it's happening in the United States and how many people are being diagnosed with it.
Well, speaking of that now, let's maybe review a little bit of what Parkinson's disease actually is. How is it diagnosed? What causes this? Symptoms, treatments, all of those things.
Yeah, in a nutshell.
In a nutshell, yes.
It's Parkinson's disease is a neurodegenerative disease. So it takes place in the brain, and it's a progressive disease. So there is no cure, and it continues to get worse over time. It's a lack of the chemical called dopamine that's being a neurotransmitter. It's a chemical that connects the brain really to the rest of the body, the muscles and the movement. It affects muscles and movement. Most people think of Parkinson's as a tremor, so shaking disease, postural, people are stooped over, they have difficulty walking, balance, they have difficulty talking. Those are a lot of the motor symptoms. Masked faces, sometimes the people don't smile or they don't look like they're showing emotions on their face because their facial muscles are rigid. People become stiff, but there's a lot of non-motor symptoms that are associated with that, like anxiety, difficulty sleeping, gastrointestinal issues, constipation, urinary problems, mental health issues. Some people have hallucinations, delusions. It can affect so many different systems, and not every people are the same. They are affected very differently. So the movement disorder specialists who deal with Parkinson's really have their work cut out for them because everybody's treatment is a little bit different. As far as the causes go, some of it is genetic. About 15% of the Parkinson's cases are a genetic hereditary gene. They have developed a test to find a biomarker recently. Michael J. Fox Foundation, in conjunction with all the organizations who do research, had that breakthrough this year, which is really going to be very helpful to progress research in the area of the cause and how to diagnose it. So the diagnosis is usually a clinical diagnosis by a neurologist or a movement disorder specialist when people start having these symptoms. And there are also other tests that are more definitive, like a DAT scan, which is kind of a scan of the brain, and some other tests of they're coming up with some tests for skin tests, and that's all in the research process. So But the treatments for it really are medications that help the symptoms, and they replace the dopamine in the brain. And as the disease progresses, people need to take more and more of that medication to replace the dopamine.
I see.
And one of the treatments that has actually been showed, there's evidence behind it, is exercise. The right type of exercise, the right intensity of exercise can actually slow the progress of the degeneration of the brain. So that's where I kind of became passionate about working with people with Parkinson's, because I'm a certified instructor for Parkinson's exercise. So trying to get as many people exercising and doing that as possible, and trying to bring more programs and educate fitness instructors in the area about how important it is for people to exercise, because it's really the only evidence that we can slow the disease down when somebody's diagnosed.
And I imagine, you referred to Michael J. Fox earlier. Everybody remembers him from his early days acting, and what a comic wit he was. And we don't see him much anymore, but he is still living, even though it's been many years since the diagnosis was made public. And so do you know any more about Michael's particular approach to having lived this many years?
I just read something that he said his goal was always to live to be 80 years old. And his disease has progressed. You don't see him much anymore because he is quite incapacitated at times from the disease, but he really put himself and his family and everybody behind the Michael J. Fox Foundation to develop research, because he really wants to find a cure in his lifetime. So he does a lot of behind the scenes supporting of that foundation, as do all of the organizations. They all work together to find a cure, and everything that they discover from one organization helps the other, and the research is all funded by these nonprofit organizations.
Right. And now you mentioned the breakthrough with finding a medication that may be effective in is it in treating the symptoms, or is it?
The recent breakthrough, it's a biomarker. It's a genetic biomarker that they can actually find, and that will tell them that this person is at a higher risk for developing Parkinson's. So then they can start studying people before they have it, before they have the symptoms, and it will be a real boost to the ability to do research on how the disease starts and how it progresses.
Yeah,
and preventative.
Right, really important. If you can find it early. And
exactly,
develop,
the earlier the better.
Either whether it's treatments or, in all likelihood, a combination of some kind of medication along with lifestyle changes, including exercise and fitness.
Yep. And that's why it's so important to connect people as soon as possible after their diagnosis to other people and to the resources that they need, so they can start right away.
Right. So a program like pdbuzz, whether it's Newport or Los Angeles or wherever, really is serving a very vital function in all of that.
That's what our mission is, really to make the community more inclusive and supportive of these people, but also to educate the healthcare providers to at least tell them about us, because we can connect them with the resources. The person who developed the program in California, she was diagnosed with Parkinson's, was giving some medication and sent home. And she was diagnosed with this degenerative disease that was progressive and there's no cure. And she went home and was like, what do I do next? And wasn't given information about the resources available to her. And so her mission was to find those people who were first diagnosed and at least connect them. And so that's kind of what our goal is as well, is to educate people in the healthcare professions that when someone is diagnosed, or they have a diagnosis of Parkinson's, just send them our way, and we can connect them with the resources. We're not the be-all, end-all of resources. We would talk with them about, where they're at with their Parkinson's. Do they need some referrals? We would refer them to the local chapter to get some referrals or information about local doctors or therapists that they need. We would give them the information about the local exercise programs, which fitness professionals are certified or trained in helping people with Parkinson's. it's real important for someone with a disease to know that the person they're exercising with knows what's going on with them, so that they don't have to explain it to them, or so that they can feel safe. So those programs are really important, and to hook them up with the support group and other people, because really that's what they need. They need to, I think sometimes doctors and healthcare practitioners are afraid that when they go to a support group, they're going to find all these people who are so much worse off than they are. And they don't want them to kind of become discouraged or depressed, but our support groups aren't like that. They're, really positive people who want to help each other and get as much information as they can.
Well, I think that's so important, given the fact that PD Buzz is the clearinghouse for those that information and referral, so that people who have been diagnosed, along with their care partners, have a thorough education about what the disease entails, what they can expect to take place as time goes on, and so on. And, that's just really, really vital.
Yeah. So, and that's where we're going right now. We've had tabling events in the area. We had informational tables with information from the various organizations, with information about local programs, local resources. We did it at the YMCA. We've done it in the local senior centers. Just information so that maybe they'll take something home, and eventually they might say, "Oh, I need to exercise more. Let me go find that piece of paper or find that resource person." I also do field a lot of questions. I think that you'll have access to my. Oh, there it is. My email address at pdbuzzNewport. We're a committee of 5 people, so it's not just me. I'm the leader, but I've recruited some. We have care partners in our group. I have another physical therapist in our group. People with Parkinson's disease who are, we work together. One of our care partners is in charge of getting the information into the newspaper in Tiverton, Portsmouth area. Another person helped me with some of the tabling events. So I draw from we have some support there too. But I do field a lot of emails and questions. If you email me, I'll get back to you. I'm an ambassador for several of the organizations. I'm a support group leader for the local APDA chapter. And so I don't have all the answers, but I certainly do know where to send you for the answers. And if I can't find that, I'll look for it. I had somebody email me the other day whose family member has Parkinson's and couldn't use his smartphone because of his tremors, because of the touch screen. And I was able to find resources for her to enable the phone through the accessibility app, and so if I don't know the answer, I'll look for it, and if not, I'll hook you up with the person who does know the answer. And a lot of times that's referring you out to call this person. They really know a lot about that. Or if you're looking for a PT or an OT or a movement disorder specialist, call, the helpline at the APDA Rhode Island chapter, and they have a whole list of those things, and they can help you with it. So it's kind of farming people out too to where they really need the resources. Right.
Well, I'm aware of there are a few what we call health education workshops at East Bay Community Action, and one of them is called Matter of Balance, for instance.
Yes.
And I don't know if you've heard of that, but we are always on the lookout for opportunities to present that program. If we have, I think, at least 6 people who will start the group, they'll start a Matter of Balance. It's something like a 6 or 8 week program, I think, and they meet a couple of times, 2 or 3 times a week. Another one is called Walk with Ease, which also might be a good...
I used to be a leader for Walk with Ease through the Arthritis Foundation.
Okay,
yeah. So and those are types of, we call them PD adjacent or PD informed, or PD adjacent is more Parkinson's disease adjacent, because the goals of a lot of the exercise programs like Matter of Balance and Walk with Ease are exercise that would benefit people with Parkinson's. And so we definitely encourage people to participate in those things. And then you have a PD-informed exercise program where the person has taken maybe a training or some continuing education, the leader of the program, and learned about Parkinson's, so they know the specific needs, and they can be on the lookout for maybe what their symptoms are, so that the people who take the program can be safe or confident. And then we have PD, our Parkinson's certified instructors, and those exercise programs are specifically for people with Parkinson's, and it's all based on what the recommended guidelines for exercise are people with Parkinson's. And so we encourage people to, whatever exercise they're going to do is the best exercise that they can do, because if you're going to participate in something and you enjoy it, so you're going to do more of it. So we definitely will. We have a list of the senior programs, and those types of exercise programs are definitely
So that's
helpful.
part of your information and referral database, if you will. Right.
We have a couple of, and if anybody knows of fitness instructors who are doing community programs who would like to know more about Parkinson's and become more informed about it, the APDA and the Parkinson's Foundation have online courses that they can take that will give them a certificate to become to understand more about Parkinson's, and then we could let people know that these are the people who know a little bit more. They're a little bit more informed. So you can feel confident that they know about your Parkinson's disease.
Excellent.
And as a matter of fact, that's one of our goals, is to get more fitness instructors educated, and so then they don't need to be Parkinson's programs, but they will know that leader of that program is more knowledgeable in Parkinson's disease.
Has the background and the experience.
Right.
Sure.
Yeah.
Sure.
So personal trainers, anybody can take those programs.
Okay. What have we not covered here? We have a little bit of an outline.
Yeah.
I see something here about how we are helping PWP.
People with Parkinson's.
People with Parkinson's.
It's a lot. It's hard to say that sometimes, or to write it out, so it's a little abbreviation.
Okay.
But so far, what we've done is we've gone from 0 in 2020 exercise programs for people with Parkinson's, and now that in Newport right now we have a specific Parkinson's exercise program every day of the week, and a couple days we have so we have 6 new programs for people to participate in for exercise. We've done, like I said, we've done awareness programs at the senior centers and at the YMCA. And so now we really are starting to focus, because it's Newport County, is not just Newport.
Right.
So our major focus right now is bringing some of those programs into Tiverton and Portsmouth, Little Compton area, because that's really kind of the, I hate to say dead zone, but they have to travel all the way to Newport or Fall River in Massachusetts somewhere to go to these programs. So my focus right now is to really see what we can get going in that northern end of Aquidneck Island and across the river, I guess,
yes.
In Tiverton and Little Compton. We do have a weekly walking group. I don't lead it, just a couple of my support group members lead it, or they actually don't lead it, but they host it, and people can go to the Town Farm Park in Tiverton on Thursdays and walk together as a community. So we're starting to get into that area, but that's really our focus right now, is to get into that part of the Newport County. And the reason we kind of chose Newport County is because we wanted to make it local enough so it's a community. Yeah. So it doesn't mean that people from Bristol can't come to these programs. I do have someone actually come into my exercise program from Bristol. It doesn't mean they can't come from Jamestown. It's just that this is the geographical location that we're kind of really focusing on right now.
Sure.
And to keep it local, and because we're aware of what's going on in our community. So.
Well, you brought a grin to my face when you mentioned the Town Farm in Tiverton, because it reminds me of, we have 2 daughters, and my younger one, when she was about 3, discovered the zip line.
Oh, at the
Town Farm in the playground, yes, and she was
it's a great
an avid
walking area.
zipliner.
It's a great walking path. It's a 1/3 of a mile. We have the APDA Rhode Island chapter has their major fundraiser of the year coming up in September 28th. It's a walk, and they get people to join it, and actually it's a huge just family event. But we actually, with the support group, will last year, and hopefully going to do it for the year, the month before, is meet and walk each week. And Town Farm is a 1/3 of a mile track there, the walking path. So if you do it 3 times, it's a mile. And so then if you can do that walk 3 times in a row, it's a mile, and you can come to the APDA, and you'll know that you can walk the mile at their walk.
Right.
So, yeah, that's a great area. But so we really want to get more we have limited bandwidth. We have limited resources with we aren't even an organization. We're a committee. We're 5 people.
Right.
So we're not a nonprofit. We're not anything, really. I house a page on my personal website so people can go to that and find the information that's there. But we really, we would love to get partnered with collaborate with some organizations in the Portsmouth, Tiverton, and Little Compton area to start bringing awareness.
It certainly seems as though the potential is right here.
Yes.
To get that done. So I will definitely make sure to give you the contact information for East Bay Community Actions. It's the Office of Volunteer Services.
Okay.
And we have a colleague of mine, Eric Tapley, who coordinates that and seeks to recruit organizations or like a senior center or whatever to even retirement communities like Harbor House or any of those other senior subsidized communities to bring together some groups and do that kind of work with them. And so I know he'll be delighted to hear from you to work together on.
Great, and we can spread the word and get those resources out. And I know this is senior sounding, but Parkinson's can be diagnosed. We talked about Michael J. Fox, and not everyone is a senior who is diagnosed. Some people are diagnosed in their 30s. It's called early onset Parkinson's disease. So that's a whole other area of people who are still in the workforce and working and have young children, raising their children and working, have Parkinson's disease. And so that would be another offshoot of the different needs, so that in the community and getting different groups, support. They need different support than someone who's taking care of their elderly mother with Parkinson's disease, someone who's also caring for and supporting their 40-year-old husband who's still working and has children. So there's a lot of need out there that we're going to try and kind of tentacle out.
That's exactly the kind of audience that we have. It's seniors, usually with a care partner, caregiver, who, in the majority of cases, more than half, I would say, is an adult child. Who obviously there are spouses and in-laws and children and possibly grandchildren, and so there's obviously
Parkinson's affects the whole community, and that's why it's so important to make the community aware of their needs, because it's not just the patient, it's everyone.
Yes. Well, Kristin, we're just about out of time, so I want to thank you for enlightening our viewership here. This is a topic that we have not yet broached on the program, even though we've been doing it for a few years now. But I want to thank you for joining us today. You're very welcome. And viewers, thank you for joining us as well. We're all done for now, but please join us again for our next episode of Senior Soundings. So long.